Hi, folks. This message is only relevant for full-time faculty members, so if you're not, you don't need to watch any more of this. Also, this message is specifically for full-time colleagues who have the Anthem Blue Cross plan, whether it's PPO or HMO. Both of those plans may possibly not cover UC Health services starting January 1st, 2024. Human Resources sent an email to you yesterday or the day before, alerting you to that fact, but this is just another blast really to help you really look into it and think about it and see whether or not this is something that is going to need you to change your insurance coverage. It's a very personal choice. It's stressful. Nobody wants to change their health insurance plans. And so what you really have to do is you've only got one more week. October 13th is the deadline by which you need to submit forms to change your health insurance plan to our HR department. They will hold on to those forms, and if something changes before the date regarding the UC Health and Anthem coverage battle that's going on, they may be able to hold back your forms for you. So in a nutshell, there's a fight going on between Anthem and the UC Health system, and Anthem is saying that UC Health currently will no longer be in network come January 1st. Of course, that could mean expenses go up hugely. They may agree before December 31st, but we're in a bit of a bind, right? Because you can only make changes to your plan before or by October 13th. So it's a tough one. We've contacted statewide folks and others who maybe would have some influence on the system. But this is really going to come down to Anthem and UC and who blinks first, I think. So you have to decide whether you want to take that risk that coverage, if you have UC providers, would be out of network, or whether you're comfortable shifting to another provider, or whether you could shift to an HMO plan. So the Blue Shield Access Plus HMO does cover or does include almost all UC Health providers, and you can check in the email that Human Resources sent out whether or not your primary care physician or the group that you may be working with already, whether they're covered by that Blue Shield Access Plus plan. But none of at the moment, the problem is that none of the Anthem plans, HMO or PPO, will cover the UC Health system. Maybe they'll change their minds, but that's what you have to kind of balance out. Do you think they will? And it's up to you. I wish I had something concrete. I wish we had some other leverage we could apply. As I say, we do have our statewide partners trying to put some influence into this as well. Anyway, I hope that I know you can deal with this stressful thing without too much distress. All right, thanks everybody. Bye.